core action grant was designed very much in line with the strategic objectives of the Global AIDS strategy, focusing on the inequalities that exist between EU member states, but also between communities that are affected by HIV or living with HIV in the different member states. And the strategic objectives of the Global AIDS strategy, which are really focusing on community leadership, are reflected in the activities. The implementing partners, together with regional networks of key populations, but also people living with HIV and HIV service organizations, have been working together on making sure that the community leadership is in testing, linkage to care and treatment services, but also in advocacy activities, is done during these 3 years of the project.
The main objective first of CORE was actually to engage several local organizations from 12 different countries with different realities into strengthening what we call integrated rapid testing, so the availability of testing for not only for HIV but related infections like viral hepatitis, STIs, and also to address different key population, taking into consideration the needs of specific populations.
I'm truly blown away by the results that are presented. Thousands and thousands of tests performed, hundreds of people linked to care who otherwise would have fallen through the net, but could be caught by this network of organizations working together in CORE. And I think that this is tremendously important, because what we see here is not just a proof that the communities of people who are usually left behind or unseen or treated as less than can do meaningful work, but also how much they contribute to a functional healthcare system.
It was one of the first time that the European Union financed actions and service provision in Europe, and not only research and other development projects. We managed to continue, and more than continue, reach new populations and new people for testing for HIV, hepatitis B, C and syphilis in 3 cities in Romania, which was very important.
We practically tested people who use drugs, migrant populations, sex workers, MSM, trans people. And the whole idea was, apart from scaling up, try to find a way that, apart from the referrals, those people were linked with the healthcare settings of Thessaloniki. We had also the opportunity to establish a very interesting communication with doctors, and always try to find ways that those people were not left behind.
CORE project gave us the opportunity to sustain the HIV testing and case management for 3 years, which was a very good opportunity. But on top of that, we were also able to provide full diagnosis of 4 types of STIs and providing also treatment.
We used this opportunity of collaboration at a CORE project to create the website, a professional website when you can order for free test for HIV to do at home. Interest of the self-test was such a huge success that after a few months we find out that we don't have already the tests. And then WHO came to us and said, okay, you have the capacity, you have the website, so we can organize for you 10,000 tests. And it helped us to continue the project. So EU helped us to implement our project and collect all proof that it works.
We tried to create spaces where we could bring community-led organizations and community members in the same room with political people, with either policymakers or people who are working for the European Parliament or working for national parliaments.
We tried to help the communities make their voices sound more strong and more supported.
We also organized a stakeholder meeting in Paris. It was really well received. One of our organizations were invited to be received in the Health General Direction for one of the actions they are doing on the field.
We had two awareness activities, one in Thessaloniki and one in Athens. In Thessaloniki, the activity focused to the migrant and refugees population about the barriers and the access to the healthcare system. And also in Athens, the focus was about sex working, the needs and the problems of the community, and also, again, the access to the healthcare system. We had also members of the Greek Parliament in those meetings, so it was very important about the advocacy.
It's been 3 very creative years, thankfully, to this project. We were able to enhance our capacities, to create new collaborations with local stakeholders in Cyprus, new collaborations with the local Ministry of Health, with the National AIDS Addictions Authority. We got into testing currently for hepatitis B and hepatitis C, which was a goal for us, and we managed that. PrEP started in Cyprus, which is huge.
During this period of 3 years, we're able to work with peers, and also we're able to increase the test uptake in our organization, not only to the African communities that we used to serve, but we had other migrants that access our services.
We as African heads can now train peers ourselves and give them certificates so that they can start testing in the various communities.
NOASAC Mosaic is working with an integrated program to reach migrant population in the southern part of Sweden. We were testing for HIV only, and through this core project we have added syphilis, we have added hepatitis C, and we have added hepatitis B.
Through the platform of the core, it has given us that possibility to be able to employ peer workers, volunteers on the project. We have adopted a model where we use the mobile van to go into regions, practically places where they will say, how to reach people. The issue of language, which has been recognized as some of the barriers that our key population used to have, was actually solved through the peer workers, because we have these people from all over the world.
What we get from the core in terms of financial support is nothing to compare with the knowledge, all that we have learned.
One of our greatest outcomes has been the toolkit that we've been able to produce as a resource. We did a series of training and capacity building initiatives where we were addressing a lot of issues to do with access to prevention, testing and treatment. We talk about needs of people who are trans. We talked about migrant communities. We talked about cultural competency.
We take advantage of the data collection system that we already have in the Competency Network. It's a data collection system to have this harmonized data. And one of the objectives in this project was to update, to improve this data collection tool.
We think that the core also allowed that several organizations from different contexts, joint efforts, come up with creative solutions. They learn with each other, and we strongly believe that although core is ending, it will not end after all, because these organizations will keep talking to each other, will keep learning to each other and exchanging experience. And that's, I think it's one of the most interesting outcomes of core.
The Global AIDS Strategy set the testing and treatment targets that most people are familiar with. These are that 95% of all people living with HIV know their status, that 95% of diagnosed people have access to medication, and 95% of those who are on medication have reached an undetectable viral load, which means that they are not infectious, they cannot pass it on through sexual contact. Europe, as in general, has failed to reach these targets. This has many reasons. One of them is that there hasn't been enough sustainable funding for community leadership in the HIV response, and also that some of the targets have not been taken so seriously, have been neglected, We talk about them as the social enablers targets, which is reducing the number of communities that have been criminalized, or discrimination and stigma should have been addressed much more seriously if we are taking seriously that we want to have people coming for services and get tested for HIV. So we have experienced that in the European Union, and especially by the European Commission, there has been reduced interest towards investing into HIV, both politically but also financially. There hasn't been a continued interest and funding for HIV, TB, viral hepatitis and STIs. In the current work program, there is no mention of HIV. There is no opportunity for organizations to apply for it. And in general, we can see that public health has been a bit out of interest of the Commission at the moment.
I really do believe that very soon the problems will be back and will be so huge that we will have to deal with this again. We will have to deal, because we can already see, even though a slight increase, but we can see an increase in the number of new infections, even in the west of Europe and also in North America. This is a slight increase now, but if we continue with the policies as they are now, it will be a sharp increase very soon. And this know-how, this knowledge, these capacities that our communities and our organizations are trying to preserve will be needed again. Why do we have to wait until then? I mean, this is insane.
Core Action Grant strongly demonstrated the role of communities in ending HIV and AIDS, but we cannot do it without sustainable funding and reliable funding. Community responses is a key cornerstone of HIV and other communicable diseases pandemics if we want to end them, if we take it seriously. So now in the last 5 years, until the 2030 targets to ending AIDS as a public health threat, not just the member states, but also the European Commission must do its best and take a real political will and statement and show it by funding that they take these targets seriously.